Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. Our guest is Dr. Suman B. She's a medical oncologist, board certified in hematology and medical oncology as well as internal medicine. And she's here today to discuss biomarker testing, how it works, and why it's very important as far as lung cancer is concerned. Welcome to Health Professional Radio, Doctor.
Thank you very much, Neal. Thanks for having me today.
Lung cancer is one of the more aggressive types of cancer. Are you a specialist in lung cancer, or are you just passionate about lung cancer among other cancers that you have experience with?
So, Neal, I started my fellowship. I did my fellowship actually at the University of Texas in Dallas Southwestern Medical Center, and then I've been practicing in Baltimore and in Maryland and at the MedStar Franklin Square Hospital. I started out actually seeing more breast cancers than lung cancers, but more recently my practice has been geared more and more toward lung cancer. And I think it's just been my passion in a way, and it's the more I see, the more it's been heartening to treat patients with lung cancer more today than it was many years ago. We've had a lot of new developments with lung cancer treatment, and it is exciting actually to be able to see these developments and make a difference with lung cancer treatment for patients today.
Dr. Rao, what is biomarker testing for our listeners who aren't familiar with the term or the technology?
So biomarkers, with cancers in general, we look for biomarkers. Biomarkers are substances that can be markers for a disease, and they're found in cancer, in normal tissue as well as in cancer tissue. And it sometimes helps us with diagnosis. Sometimes we use those stains to say, okay, this makes a diagnosis of lung cancer. It helps us make diagnosis sometimes. But more often than not, what we use biomarkers in clinical practice is basically to help with treatment. So there are substances which are present in normal as well as cancer tissue, but the cancer tissues tend to depend on these molecules, whether they be genetic alterations or certain chemical pathways that are utilized by the cells to help the cancer grow and prevent destruction. So that has become a very important part of practice.
Does the effectiveness of these biomarkers depend on a person's age?
Not at all. The biomarkers are not anything that's inherited. It is the cancers that recruit these pathways, so to speak. And so if, for example, the EGFR, the ALK mutations, the AutoS or ROS mutations, these are something we use in practice today. Mm-hmm. And these are genetic alterations within the cancer cells. So it's not something that, is passed on from generation to generation. It's a cancer that uses these mechanisms. These are normal cell cycle mechanisms, but the cancers then become dependent on them. So they act as drivers for the cancer, these genetic mutations. So that's something we test for routinely and treat. If they're positive, then we can use drugs that are specifically targeted to block these mutations. Of course, more recently, immunotherapy has been more in the news, and immunotherapy has become an important part of lung cancer treatment. And there, the biomarker we look for is PD-1 or PD-L1 pathway. And the PD-L1 testing is useful to help determine which patients seem to benefit more from immunotherapy. So these are, all of our treatments are, to some extent, have side effects, and they don't work for everybody. So the idea of biomarker testing is so that we can use the right treatment for the right patient and make it as effective as possible for that patient.
How recent of a development is this biomarker testing technology?
So biomarkers have been around for, I would say, about 20 years now. But the first biomarker in lung cancer that we found was the KRAS. That was about 20 years ago that that was discovered. But recently the developments have been much more rapid. That 20 years ago we just knew that KRAS was mutated in lung cancer. Now we have we know at least about 15 specific mutations for lung cancer that can either be what we call driver mutations, which means that the cell is totally dependent on that mutation, or like the PD-L1 pathway, help the cells sort of camouflage and prevent destruction. So in the last 10 years, we have really made a lot of advancement in detecting these biomarkers.
Can you determine the side effects, if any, and the severity of those side effects with these biomarkers on a patient-by-patient basis?
Yeah, so not always. So we know specifically that with the EGFR testing, if we have a patient that has the EGFR mutation, they're more likely to get side effects from the treatment that is targeted to that. But at the same time, it is also more efficacious. So with the PD-L1 pathway, not so much. It's not that the side effects are, we don't know that the side effects are dependent on the PD-L1 pathway being there or not. That is not as clear-cut. So sometimes yes, and sometimes not so much.
And would you please tell our listeners where they can go online and get some more information about biomarker testing and how it relates to lung cancer?
So we're talking today specifically about the testtalktakeaction.com. If you go to that website, the website lays out more information about biomarker testing that patients can use. It also has a guide for patients to then take to their physicians, and they have specific questions that they can then discuss with the physicians. And it's always very important for the physicians to discuss it, but sometimes it is complicated treatment, and it's always good for the patients to be prepared when they go to the doctor's office.
Thanks for coming and talking with us today, Doctor. It's been a pleasure.
Thank you. It's good to be here.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Suman Rao. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.